again for being here. We'll now move to the question and answer session. By a show of hands, my first few questions, it would be faster to know what's going on. But the first question is, which of your companies own or control a health insurance division? Raise your hand. Please keep your hand up if you also employ healthcare providers or own clinics, specialty pharmacies, or any other kind of medical practice or pharmacy. Please keep your hand up if you also own or control a pharmacy benefit manager. And please keep your hand up if you lead a publicly traded company at which you have a legal responsibility to maximize shareholder value. So we've established on the record that the largest health insurance companies are not just insurers. They are also medical providers and pharmacies, diagnosing and deciding treatment for patients. They are also PBMs, another form of middlemen managing drug benefits. They are increasingly controlling every aspect of our healthcare system. This level of consolidation helps explain why Americans feel very anxious about their health care, because the coverage they have, the drugs they rely on, and the doctors they can see are increasingly controlled by the same corporate families. This level of control and consolidation is supposed to lead to greater efficiencies, lower premiums, and lower deductibles. But that's not what has occurred. In all of our districts, we are instead hearing from individuals who are being denied coverage for needed treatments. As just one example, a breast cancer patient from my home state in Missouri needed a shot to prevent against infection prior to her chemotherapy, but was denied by one of your companies, and only received approval for the care after she already contracted an infection and was admitted to the hospital. With the rampant practice of treatment denials, as much as 1 in every 5 services for Obamacare plans, and rapidly rising costs coming from your hands, this is a yes or no question for each of you. Do you all believe you are doing what you need to do to lower cost and protect coverage of care? Mr. Hemsley.
Chairman, I think we are doing an amazing job in terms of addressing that, but it is not enough. We could do more, and I think we have to approach the totality of the system with that point of view.
Mr. Joyner.
I absolutely believe we're doing everything we can do to make care more affordable and simple. It's part of our purpose as an organization, and I have 300,000 employees that are committed to doing the same.
Ms. Boudreau.
Congressman, we have 2 core priorities: to reduce the cost of care for the people we serve and to improve the simplicity in how to do business with us. We, though, believe that there is no simple solution, and we need to work together with everyone in the health ecosystem to do better, as I said.
Mr. Cordani.
Mr. Chairman, we largely serve the employer-sponsored market in the United States, and most of that business is self-funded or fully transparent, and we work every day to reduce the cost of care. Additionally, we just launched a new pharmacy benefit offering that is fully transparent, no rebate, no spread pricing, that will further improve affordability. So we work every day to lower the overall cost of health care or deflect the medical cost trend on behalf of our employer clients.
Mr. Markovich.
No, because it just costs too much.
Thank you. Last week, President Trump announced the framework for what he called the Great Healthcare Plan, with a major focus on restoring trust in the American health insurance system, requiring transparency in prices and justifying claim denials, disclosing what premium dollars are actually spent on, and holding middlemen accountable for shady kickbacks, and simply having you all communicate to patients in just plain English what they are paying for insurance, why and what coverage they get for that rather than hiding important details in the fine print. This mirrors and builds on what efforts Republicans in Congress have taken to lower cost and increase transparency for patients. This is a yes or no question for each of you. Will you commit to supporting legislation that supports the president's calls to truly bring transparency to health insurance, will crack down on fraudulent enrollments, and hold insurers accountable for their excessive prior authorization and care denials? Mr. Hemsley.
Chairman, we applaud the president's interest in this and focus. The ideas put forward could be part of meaningful change and solutions. We are aligned with the themes of those on transparency, accountability, addressing costs and improving the system. So we'd be supportive of that as part of a broad-based, bipartisan solution to move forward in healthcare.
Mr. Joyner.
Yeah, we share the president's and this committee's goal in reducing healthcare, simplifying it, using plain English in which to interact with the patients. So yes, we are very much aligned with this committee as well as with the president.
Ms. Boudreau.
Chairman, we support transparency. We also support many of the tenets of the president's policies. We encourage us to make sure transparency is also available through hospitals, and we have a priority across our company to simplify patients' ability to understand their coverage as well as the costs.
Mr. Cordani.
We support improving transparency, expanding choice, and aligning incentives, so yes.
Perfect. Mr. Markovich.
Mr. Chair, I support all the principles that you outlined, and I particularly want to point out that in my opening statement, I referred to kickbacks as an issue.
I did. I appreciate your testimony, Mr. Markovich, and your frankness. So clearly, we aren't all doing everything that's possible to lower cost and cost for patients and take accountability. And so by saying that you would support this reform, you clearly are admitting that there's a problem. We all know there's a problem. That's why we're here. It's a shame it's taken a congressional testimony for you all to commit to putting patients over profits, but we can do better. And we have to do better for the American taxpayer, the American individual who is just trying to get by to put food on their table, clothes on their backs, and gasoline in their cars. I recognize the ranking member.
Thanks, Chairman. Thank you.